Welcome to today's press conference on COVID-19. With us today are Undersecretary for Food and Health, Dr. Chui Tak-yi, Dr. Chong Shuk Kwan, Head of Communicable Disease Branch of the CHP, and Dr. Sarah Ho, Chief Manager of the HA. Undersecretary, friends of the media, fellow citizens, COVID situation is very serious. The number of positive cases yesterday stood at 4,300. Since the beginning of COVID to yesterday, we have registered 30,955 positive cases. From January to yesterday, the number has reached 16,600. In other words, the number of cases in the fifth wave has surpassed the total of 2020 and 2021. The sudden upsurge has posed a severe challenge to our anti-pandemic work. The government is trying to resolve all the bottlenecks like testing and quarantine facilities. The number of fatalities has also gone up, which we are really saddened. While the hospital authority is trying to send the high-risk sufferers to the hospitals, for those with minor symptoms, they'll be sent to the community isolation facilities. But because of the sheer number of cases, we have to speed up turnover of the hospitals and the CIF to make optimum use of the facilities and allow the deserving cases to be dealt with properly and to minimize the risk of infection. To this end, after consulting the experts, the HA and the DH will, on the basis of risk-based approach, adjust the number of days people spend at the CIFs. Generally speaking, if the home situation allows, like they're not living with anybody or the family members do not have any high-risk people like senior citizens, pregnant women, or immunosuppressed people, then if they test negative 7 days after confirmation, then they can leave the CIFs and go home. But they have to stay at home until the 14th day, and a test would be conducted. If they test negative, they can leave. If they test positive 7 days after confirmation, they will continue to stay at the CIFs until the 14th day and will not leave until they get a negative result. If the home situation doesn't allow, i.e. they have high-risk family members, then they will have to stay for 14 days after confirmation, and they will not leave until testing negative in order not to transmit the virus to their family members and cause community spread. There are many people with no or mild symptoms who are staying at home for admission, and we're grateful to them. We appreciate their concerns. The administration is making preparation to offer more support to these people pending admission, and they will be given wristband and anti-pandemic kits like health manual and all the medical equipment to monitor their state of health, and also the rapid testing kits. And they will stay at home and report to us their state of health. And other than the designated clinics, we have set up helplines to facilitate inquiries. If these people pending admission have been waiting for 14 days and they test negative, then they would be like those who have been staying in the CIF for 14 days. Then they do not need to be sent to the CIFs because they do not pose any risk of transmission, and they can leave their home. And all the details will be announced shortly in greater detail. For those who are under treatment in hospitals, the doctors will exercise professional judgment, and if the situation improves and the home situation allows, and if they do not pose any risk of transmission, then if they test negative 7 days after confirmation, they can leave the hospital and go home until the 14th day. And if they test negative on the 14th day, they can leave home. Vaccination is the crucial tool to minimize severe cases and deaths. And we will ramp up the vaccination for the elderly people, not least those in the elderly homes. The government and the education sector will take facilitation measures to facilitate young children and primary students. Those between 3 and 4 will be entitled to Sinovac, and those above 5 will have choice of Sinovac and BioNTech. Parents should have no more hesitation and take their children for vaccination. We have set up ticket dispensing machines at 40 CTCs and mobile sampling stations, and the queuing situation has improved considerably, and people can check their position in the queue. We will arrange for civil servant colleagues to manage crowd and to maintain the priority queue system to facilitate senior citizens and pregnant women. Fellow citizens, the COVID situation remains COVID. Please refrain from going out and take part in social activities. Please do not take part in cross-family gatherings. We should wear tight-fitting masks and observe personal and hand hygiene. Every step that we take will be very important in our battle against COVID and will alleviate the burden on hospitals. Dr. Chuang, we have 6,116 cases of positive cases, and 3,444 were tested by the our laboratory, and 2,672 cases that are positive. Of the 3,440 cases tested by the CHP, 35 carries L452R, suspected to be Delta, 3,300 suspected to be Omicron, 43 cases. The test results are still not available, and the viral load may be too low to be tested. There are 6,300 preliminary positive cases. Our lab has received 3,800 samples pending confirmation. There are some samples that have not been sent to the lab. So I urge the private labs to submit the samples to our CHP lab for confirmation. Of the 6,116 cases, 9 are imported. The rest are local cases. As of now, we have received 19 homes in which there are cases to be followed up, and there are residents or there are staff members who have to be followed up.
Right now, we have 6,190 people who are quarantined at home. These include 3,152 families, and that would conclude today's report. Ms. Dr. Ho, currently we have 2,866 preliminary confirmed patients and confirmed patients in our public hospitals, in North Langchao Hospital, in the HA hospitals, infectious disease, and in AWE community centers receiving medical care. In addition, we have roughly 2,100 patients in Penny's Bay receiving quarantine care. And right now we have 10 plus confirmed patients who are in critical condition, 214 patients who have recovered and discharged. We have an extra 24 patients who have deceased, and 15 patients who died in the last day. Another 9 patients between 11th of February and 15th of February had deceased, and these cases were too numerous, so the figures are lagging. We are reporting these figures a bit late, including the above patients, and right now we have 219 patients who have deceased, and the details will be provided in the news release later tonight. The hospital expresses regret and condolences to the deceased patients, and we will provide assistance to the affected families. The public hospital's usage rate is more than 90%, and our quarantine facilities are already at their full capacity. In the last few days, we had a lot of emergency cases where they had to accommodate patients in tents. For these situations, our medical staff are very unhappy. We are worried about our patients' care, especially today. There had been some rain, and the weather in the coming few days will also be cold. So we are thinking of different methods to accommodate early admissions. So from today on, we, as Dr. Choi, the Undersecretary, mentioned, we will adjust our discharging criteria. So when patients are confirmed positive, starting from the confirmation date, as long as they reach negative testing, but if they have high-risk family members at home, such as those who are elderly, who are more than 70 years of age, or if they are pregnant women, or if there are chemotherapy patients at home, then these patients need to stay longer under hospital care. So after 14 days after their confirmed positive test, if they receive a negative test, then they can be discharged. So we hope that through these measures we can reduce the length of stay in the quarantine facilities. This arrangement can help us set aside more capacity for patients who need medical care. The second message I want to convey is that we want to work with residential care home operators. We would like them to understand that the situation we're facing is very severe. We have a lot of people waiting for medical care who are in tents outdoors. We also have elderly patients, and even after the doctors had assessed their condition, they are suitable to stay in RCH, but the RCH refused to accept these elderly, so the elderly are stuck in hospitals. So this adds to our burden, and when the elderly stay in hospitals for a long period, it increases the risk of infection. So once again, we urge the residential care home operators, they need to cooperate with us. They should not refuse to accept these elderly patients. If they have difficulties, then our outreach staff and departments can provide assistance. The third message is we would like more private operators to help us out, because we are expanding Penny Bay facility. We are increasing the number of beds, so we need a lot of medical professionals. We are stepping up our recruitment exercises. So if private doctors can register in the morning, they can already help out in the afternoon. So at the same time, we would like our private sector colleagues to help share the burden. They can help with the management of these quarantine facilities, so that would free up our staff to work in our government hospitals. I'd also want to say that our hospitals are now in a crisis situation. If a large number of patients are waiting outdoors, if this continues, then no matter how hard our medical professionals work around the clock, there is no way to solve this problem relying on our own efforts. So I would like your support and cooperation to help us through this crisis. Today, we have more than 140 staff who are preliminary confirmed positive. These colleagues were infected in our community centers. They also have close contacts who need to be monitored, and some 50 plus patients in the same ward will be listed as close contacts. We are also preparing their data, and we can present that at a later stage. The Q&A, before you raise your question, please identify your media outlet. Cable TV, will you implement the mandatory testing, and will there be lockdown in Hong Kong? Will you also have to deploy staff from Shenzhen for sampling? So the mainland experts, what are they doing when they come to Hong Kong? Will mainland provide mobile testing equipment, and how will they provide assistance? Just now, HA said that we have a lot of people waiting outdoors. It's cold and rainy. So how is HA going to handle this situation? Does HA have means to increase personnel? Now, regarding the taxi operators, we will only have designated vehicles operating tomorrow. So if people can't afford taxis, what can they do? Regarding testing, the CE had announced earlier that our different secretaries would head different teams, and they would liaise with their mainland counterparts. So each bureau secretary will work with his staff and colleagues, and they will report regularly, so the public will be aware of the progress of our different measures. The other question was about mainland experts coming to Hong Kong. So the CE had announced earlier that Dr. Sophia Chan from Food Environment Hygiene would be following up this work, and these mainland epidemiology experts will be working with the health department and will be working with their Hong Kong counterparts to conduct testing in Hong Kong, and we are making suitable arrangements. Dr. Ho, we had mentioned that patients are waiting outside hospitals, outdoors. We have observed this situation, and we will keep an eye on these patients. We'll make sure that they are warm. We will monitor their situation. If there's any change, we will take care of them. Now, we are working with other departments. They are also coming up with solutions to help us, and that includes temporary indoor shelter for patients who need to wait. Now, regarding manpower, aside from part-time help, we would also like private sector medical professionals to lend a hand. So we have streamlined our registration process. If they register in the morning, they can start active duty in the afternoon. Regarding your question about specified clinics, we would like patients to apply point-to-point logistics arrangements.
MP, my first two questions are for Dr. Choi, my last one for Dr. Ho. So the chief executive previously said that targeted testing by restriction testing declaration, or so-called lockdowns, and compulsory testing notices is better, and the Center for Health Protection's own figures support that. So would universal testing, especially coming only in March, be too late and a waste of resources to curb the fifth wave? And can we get an update on talks between the hospital authority and FHB on whether it is necessary for each positive patient to be admitted to hospital or isolated before being officially confirmed as recovered or discharged? And for Dr. Ho, yesterday you said it was, and I quote, far from satisfactory for patients, particularly the elderly, to have to wait outside hospitals for treatment. What has been done to change these conditions, given that it's cold and raining today? And can the hospital authority also provide figures on patients in serious condition? So how many are there, the age range, and the vaccination status? Thanks.
About the testing strategy in Hong Kong so far, I think as our chief executive explained before, we have tried many attempts in restricted and testing exercises, and it has shown good result in picking up positive cases in an early stage. So whether the scale or the scope will be modified to suit the situation that is upcoming, I think we will announce in due course. And also, our chief executive announced, or she has assigned, head of bureaus to take up various agenda or task force after the meeting with the mainland authorities last week. So that will also be in progress, and we will announce all the details in due course. About the admission based on the test and also the modification in the discharge criteria, we are trying to make the best use of our available facilities based on expert opinions and also the degree of control that we are going to offer right now. And of course, in the fifth wave, so far there are already more than 10,000 positive cases, and also with the experience of hospital authority in managing over 30,000 cases since the epidemic, they have observed that a large proportion of young, fit, or asymptomatic patients, they only need observation but no definitive or very sophisticated medical treatment. So based on the observation and also the experts' view, it's safe to observe them at home while pending admission. Of course, on the other hand, we are trying our best to increase the capacity for admitting them when these facilities are available, and we are working on that. Thank you.
Dr. Ho, please.
We have about 16-something serious cases on hand at the moment. And for the management of the demand of patients in A&E, we have adjusted exit criteria for patients admitted to the community isolation facilities. So for those without high-risk household, if they have a rapid test done on day 7 become negative, they can be released from the community isolation facilities to home. So, however, if those with a household with including elderly more than 70 years old, pregnant lady, those on hemodialysis or undergoing immunotherapy, they have to stay in the CIF till day 14. So we hope these adjustment in exit criteria can fasten the turnaround of the isolation bed, and so as to increase the capacity of our hospital to intake more patient in need. And at the same time, we also want to have a promulgation to the RCHE manager so that in case the doctor, after the examination of the elderly, in case the doctor find them fit, please kindly reaccept the patients back to the RCHE. We will provide support to them with the CGAT team, so as to help them to take care of the patients. And at the same time, we also mobilize some indoor areas, such as the conference room, try to keep the patients stay inside the hospital instead of staying outdoor. With these multiple measures, we hope to improve the situations. 60多個。
OK，下一題。
60.
邊藍色？第二行藍色衫個位。
The one in blue, TVB. There are hotels becoming community isolation facilities. The weather is getting cold and rainy. Now for those sufferers who are waiting outside the A&E in tents, we'll be moving them to the hotels, or will the hotels be designated for other purposes? You mentioned that there were 20 who succumbed to the disease. What is their age range? Is it because of the lack of care, because of the overcrowdedness in hospital, and are there any were there deceased who were waiting in the tents. There are some media reports that there will be mass testing without any lockdown. Will this be good enough? How can you make sure that the silent carriers will be transmitting the disease in the community? Are you going to consider having lockdown for testing in individual districts? And that there are mainland experts arriving in Hong Kong. What sort of role do they play in Hong Kong? And how will the government or DH work along with them if there are different in opinions? How are you going to deal with it? Undersecretary, if I may take the last two questions first about the testing arrangement. Obviously, we have implemented different testing policies all along. In terms of a meeting with the mainland, the SAR government, or indeed the chief executive, has appointed the bureau heads to lead different task groups. One of them has to do with testing. And under these 5 task forces, the secretaries will be implementing the measures and disseminate the relevant information to the members of the public to keep them updated about the current situation. As to the mainland experts, they are here to exchange views with the epidemiologists, and they will be analyzing the pathology and the all the rest of the information. I don't have further information now, and until I do, I will make available the information. For the 24 disease patients, the range in age between 36 and 98, 14 males and 10 females. The youngest patient was a chronically ill patient who needed long-term care. The one on the left, please.
Bloomberg News. I would like to ask about, now that we have been 1 week into the tougher social distancing restrictions, including banning gatherings of more than 2 households, does the government have any data on whether this has been effective in reducing the social activity of Hong Kongers, given that the case numbers are still increasing exponentially? And my other question is about the mainland China experts. The director of the new National Bureau of Disease Control and Prevention, Wang Heshen, was reported to have arrived in Shenzhen today, and he is helping to coordinate the effort to assist Hong Kong in the fight against the outbreak. Does the Hong Kong government have any plans to work with this new bureau to establish a stronger coordination? Because the bureau's mandate, which was published yesterday, said that they are setting up a Hong Kong, Macau, and Taiwan office specifically to work on pandemic preparedness with these regions. Thank you.
For any particular social distancing measure that we have implemented, it's not easy to single out any particular measure effect in the control of epidemic, because everything add together. For example, limitation of gathering, people allowed to be gathered in either public area or also in cross-household gathering, and also closure of many facilities, and also work from home, for example. So it's difficult to isolate which factor is contributing to what effect. But of course, we'll try to close monitor the epidemic situation, and by now, the situation is still worsening. As you know, the reported positive cases yesterday is significantly higher than that yesterday. And for the our exchange with the mainland relevant parties, we are starting the communication work and also liaison after the meeting in Shenzhen with the mainland authorities. So in due course, when there's any progress, we will inform the public. Thank you.
好，下一個提問。右手。
Now TV, I would like to ask the Undersecretary, could you state clearly, will there be mandatory testing for the whole population? Will that be the ambit of a different secretary? Can you disclose any information? So before we have mandatory testing for the whole population, we are already under a very difficult situation. So more testing will have to be done. So how do we deal with more confirmed cases? So have you also seen elderly waiting outside hospitals? Can you comment on that situation? Why do we have this scenario? Now, previously you had said that the high-risk groups such as elderly and children should go to hospital first, but now the hospitals are full and they are waiting outside the hospitals. So would it be better for them to stay at home now rather than waiting outdoors? I also want to ask the HA, just now you urged the residential care homes, you want them to cooperate, you want them to accept patients who have mild symptoms. So could you tell us, are there a lot of RCHs who are denying patients returning to RCH? Is it because of that they are staying outdoors and have their situations deteriorated because of that? Well, regarding the testing, the SAR government has adopted different measures. The CE recently also shared some experience from the past, such as testing, and a lot of that has been effective. We did testing in high-risk areas. So how do we progress on that basis? Well, the government will announce the details at an appropriate moment. Regarding the medical system being stretched thin, we are tackling the problem on many fronts. There are different bottlenecks, we are aware of that, and before the press conference, the HA also said that they are at already a certain percentage of saturation, and we see that patients waiting for admission or patients waiting for community centers, we are aware of this problem. So the CE had announced that we will be looking at housing estates. The advantage is that we already have some hardware in place. We can make minor modifications and make it available. Another option is hotels. We're working on that and the response has been positive. Third, if we can adjust the hospital discharge criteria, and of course they have to meet with infectious disease protocol and standards. When they are released, they should not increase risk of infection. So through these adjustments, we want to facilitate higher throughput and the use of our facilities. Now, the elderly who are waiting outdoors, of course, this is not ideal. We have not done a lot of statistics. We would like RCH to cooperate and accept the elderly back into RCH. Next question. Ming Pao, first I'd like to ask Food, Environment, Hygiene, the latest arrangement where the discharge date, how many days can you shorten the length of stay? Now, when you test them, is it the saliva sample? Will you provide sample bottles, or how will they deliver the samples? Will they have to rely on friends and relatives? And if they are tested positive, how will they be admitted to the quarantine center? Will they stay at home? I also want to ask, will you consider patients staying at home? Because in Singapore, people conduct tests and they stay at home for 7 days, and after 7 days they are free to leave home. The next question is for HA. So how many patients have you handled so far? What is their condition? What is the most serious case? Do you have any statistics? How many days have patients stayed in the community before they were admitted? Will you consider remote consultation? What is the capacity of Penny's Bay? Is it 3,500? Do you have sufficient personnel to handle patients there? And lastly, the quarantine facilities under HA, what is the capacity and usage rate? And have you looked into how many patients are waiting outdoors? Aside from Queen Mary Hospital being converted, will other hospitals also undergo conversion? And so patients who have a CT value under 30, will they be sent to the Convention Exhibition Center? I'll handle the question about the discharge criteria for quarantine facilities. What benefits will that generate? Well, some people can leave after 7 days, and on the 14th day, if they test negative, they can leave. So that's the simple response. The third question is about the manpower in Penny's Bay. We have sufficient manpower. They are responsible for workflow, medical services, and other support. There's also a question for people who are infected at home, and the testing and details we will announce later. Well, yesterday, the designated clinics, they consulted 700 plus patients. We are accumulating experience. The majority of them have mild symptoms, and after dispensing some medicine, they return home. Regarding remote consultation, we have a hotline for patients. They can phone and make inquiries. We have nurses and medical staff handling the calls. We are also considering, if they have further medical questions, we can have private sector staff handle further inquiries relating to their condition. So we are considering this option. Could you repeat the question? If the patient is tested positive and they are not admitted to a quarantine facility within 7 days, and then if they test negative after 7 days, do they still need to be quarantined? Can they leave after the 14th day?
I hope I get your question right. It is positive. No, I'm talking about the home situation allows if one tests negative 7 days after confirmation, then he will leave the isolation facility and go home. But the 14th day, the test has to be undertaken. For those pending admission, if after 14 days the patient tests negative, then it would be no different from those in the CIF. The 14th day would be the cutoff point. The gentleman over there, AM 730. Does it mean they're waiting for 14 days without any risk? There is no need for admission. Is it tantamount to implementing a home treatment policy? And there are some patients who don't who can leave after 7 days. How soon will this be implemented? There are so many people who are waiting at the triage station. Are there any cases of hypothermia or people passing away while waiting? And you talked about moving some of them indoors. Are you talking about the hospital premises? And can you give us more information about the critical illness? Now, this is not a form of home treatment at all. It's just that we're making some new arrangement for those who are pending admission. As to the implementation date, Dr. Ho, do you have any details? In terms of the arrangement for the community isolation facilities, the arrangement goes into effect today. Now, for the critical patient, the age range, perhaps I come back to you later on. Speaker not coming through. We are monitoring the conditions of the patients. We haven't seen anything like that. Second row on the right in brown. Tai Kung Pao. Every day there are more than 100 hospital staff who get infected. How will you resolve the problem of shortage of staff? And also, there are some hotels that are converted into quarantine centers. How much are they going to be charging if the patients are not able to afford the hotel charges? How will the administration or the HA be handling a situation like this? Right, in terms of manpower, we have colleagues who are infected or preliminary positive, or some of them have to be isolated, and this is that there is implications on our manpower situation. We have rescheduled some of the elective surgeries, and we have slashed this down to 50% earlier, and we may be bringing this further down to 40%. That way, we can redeploy the manpower to the battle against the pandemic. We also have the overtime allowance, and we will extend the service hours for the colleagues. We also have locum doctors. We hope that the private practitioners will be joining our team to serve the public. We are looking to see whether the private organizations that can share some of the management and operation of the isolation facilities, and that will enable us to redeploy our staff to the front line to battle against the virus. Now, for isolation, wherever it is, we have to bear in mind the public health considerations, that they don't have to pay anything at all. I wanted back.
Questions from RTHK. So, some infected people with no and mild symptoms can go out after 14 days of self-isolation at home if they test negative. So, is this a general guideline or is this a mandatory rule? And what are the infection risks? And as mentioned just now, some elderly care homes refuse to take back the elderly patients from public hospitals. So how many such cases are there, and did they explain why they refuse to do so? And as there are 7 public hospitals reaching or even exceeding their full capacity, so does the HA have any concrete measures to alleviate the burden? And the last question, as Dr. Choi said, the 5th wave infections have surpassed the total number of cases in the past 2 years. So is there a need to do mass testing in Hong Kong to control the pandemic? And can you assess the possibility of doing so? Thank you.
Well, thank you for your questions. For the first question, referring to the new measures in discharge a patient from the community isolation facility is based on, of course, the characteristics of the Omicron virus and also the experts' views, the relevant experts' view on whether it's safe from the infectious disease control perspective to release the individual from these facilities based on test result. So based on this and also the need to improve the turnover, to increase the turnover of these facilities, we adopt this new measure. So this is a practical and also valid approach to address the infection control perspective and also the need to have more facilities to accommodate people who need isolation. And for the last question about testing strategy, I think we have adopted different testing measures and strategies in the past. And of course, with the epidemic situation, we will constantly review the testing strategy and we'll announce any measures in due course to the public. Thank you.
何醫生唔該。
For the age range of the critical diseases is range from 12-month-olds to age 94 years old.
Maybe I can repeat my questions for the HA. So some elderly care homes refuse to take back the elderly patients from public hospitals. And so how many such cases are there? And did they explain why they refuse to do so? And also, like 7 public hospitals have reached or even exceeded their full capacity. So does the HA have any concrete measures to alleviate these burdens? Thank you.
I do not have the concrete number of the elderly home that refuse acceptance of the stable residents. In fact, I think it's a very difficult situation for the whole society. I think some of their staff and also they may have other worries. So that's why we will also send the outreach team to support them in case they have any worry. And for the hospital, we have reached over 90% of our isolation capacity. So that's why we are going to explore more community isolation facilities together with the government. And we will prepare and mobilize the manpower to support that community service.
好，下一個提問，右手邊
First, I'd like to ask Dr. Choi, what is the feasibility of mass testing? Has the government assessed that if there's a lockdown, how will it be done? Have you looked into that? Some experts suggest that the Convention Exhibition Center could take in patients with mild symptoms. So if there's a mass testing, how will you handle the quarantine? You also mentioned adjusting the discharge criteria. They can leave after 14 days. So if the government sends out sample kits, sample bottles, and family members can help return the samples, and while they're waiting for admission, if they test negative, then how do they prove that they've recovered? Do they have to rely on rapid testing, or do they have to go to the testing center? I also want to ask about vaccinations. 3-year-olds can take shots now. Parents are worried about side effects. So will you announce the number of juvenile cases, and will you hand it over to experts for assessment? Will you work with private hospitals and send cases to private hospitals Just now, we also heard questions about mortality rates. Have there been deaths from vaccinations? Let me try to answer the first few questions regarding testing strategy. We have to look at our conditions and the infection rate. In the last month or so, we have issued a lot of testing orders or restriction of buildings and districts. So the efficacy has been positive because a high-risk group, if they are given a specified time for testing, it helps us identify cases. It also increases efficiency. So what kind of testing will we conduct in the future? It will depend on the department's decision, and we will announce our decision when appropriate. So people who are waiting to be quarantined, we have heard different opinions and different suggestions. The government first has to consider the situation on the ground, and we have to allocate the hardware and software. We already identified public housing estates and hotels as community quarantine centers. We will continue to look at different options and look at the feasibility of these options. So we will try to relieve the bottleneck through these measures. Now, just now I mentioned Omicron. We have to consider its incubation period and other expert advice. So we have to control the risks, and we have considered shortening the hospitalization. We might not be able to accommodate all quarantine cases, and we are negotiating with the relevant parties to deal with this. Now, the question about vaccination, we have just allowed 3-year-olds to get their vaccinations, so we don't have a lot of statistics yet. I believe the side effects study group will be keeping a close eye. They will analyze the data and report back to the government. You asked about private hospitals, so are you referring to their assistance as a whole or for confirmed patients? Well, we will consider assistance from different venues. The private hospitals can provide hardware and staff. We will look into that in great depth. Dr. Chong, any comment on vaccination records? There was also a question about mortality. Mortality related to vaccinations. If we have any side effects from vaccinations, we will notify the health department. They have a scientific community looking into vaccinations. Phoenix TV, the mainland government had sent a team to Hong Kong. So the experts are epidemiology experts. So whether it is mainland experts or Hong Kong experts, they will have to conduct exchanges. And just now we heard a question about mortality. So I want to ask, why do we have this scenario? Is it because of chronic disease? Or could you can answer in Cantonese. Well, regarding mainland experts working in Hong Kong, we had a discussion on the mainland and the CE in the last few days, and she has appointed 5 secretaries and their bureaus to handle that. And part of the work is to interface with the epidemiology experts. So they are coming to Hong Kong to work on that. So I don't have the details right now, but if there is any information available in the future, we will share that with you. The question was about mortality. The ages range, mostly senior citizens. One was a 36-year-old, but that person had chronic illness. We also observed that the majority of these patients, they did not get vaccinated. So we see COVID, when it affects patients who are elderly or have chronic disease, they have a higher mortality rate. So we suggest that everybody, especially the elderly, get vaccinated. They can reduce serious side effects. And last question. I have two questions. First of all, the public are purchasing the rapid testing kits. So these rapid testing kits, are they accurate and reliable? So if the environment where they conduct testing is not ideal, if the sample is contaminated, will that give to false positive? So patients who want to get admitted to hospital as soon as possible, so will the government consider building the Fangchang hospitals that the mainland had built? I'll answer in Cantonese. Regarding the rapid testing, first of all, rapid testing has been conducted in many parts of the world. They had done testing in different environments, and they can do preliminary testing. The advantage is it's cheap, it's fast, the user can conduct the tests themselves. So these are the advantages. WHO also said that for different governments around the world, if they want to use rapid testing, there are some basic requirements relating to sensitivity. So they issued some guidelines. The SAR government has taken note of this scientific evidence and WHO's guidelines. Regarding the health department website will provide guidelines for the use of these kits, because the correct procedures are important for getting results. So we will have to educate the public on careful use of these testing kits. Regarding quarantine measures, the media have suggested many ideas. So we are trying to identify facilities to increase the hardware capacity for quarantine. So the first step is to identify public housing estates. Some 3,000 units have been identified. We're also working with hotels. We want to identify suitable hotels to use as quarantine facilities. So we're looking into different options in order to enhance capacity. But because of time constraints, we're trying to implement what is readily available. Thank you, everybody. Today's figures, we have 28-year-olds to 93-year-olds who are in critical condition, 97. And one of them, the younger person, a 28-year-old female, So she gave birth and her condition deteriorated, and she needs to be intubated and is in ICU receiving treatment. The child is safe. Thank you.